time, let me start the session. The first activity item is a keynote presentation from Dr. Naoko Yamamoto. Dr. Naoko Yamamoto has more than 30 years of experience. Recently, from 2017 to 2022, she was Assistant Director General at the WHO and also Chair of UN Nutrition. And now she is a professor and director of Global Medical Cooperation Center at the International University of Health and Welfare. So Dr. Yamamoto, please.
Thank you. How can I move to the slide?
You can just mention there is
next, please. Okay. Thank you very much. And Excellency, distinguished participants, ladies and gentlemen, it's a great honor to come here. And also I thank ADB to give us this opportunity to discuss food security, nutrition, and human development. So next slide, please. Today I'm going to, next slide, please. Or what can I do? Or put something? Okay, thank you. I'm going to talk about 3 topics, so next slide, please. First, some time lag? Yeah. Okay. Okay, thank you. So,
this is what ADB can do best.
Oh, great. No, it's great. I'm so rushed. So first, I'm going to talk about global state of nutrition, food and nutrition. Yesterday, we heard that since COVID-19 pandemic, the number of people suffering from hunger increased significantly. We heard yesterday several times. Concurrently, diet consumed worldwide are not meeting the sustainable, sustainable, healthy, and eating, leading rise obesity and diet-related NCDs, reaching epidemic level. The world is a state of double burden of nutrition, malnutrition with undernutrition, and overweight and obesity, or triple burden of malnutrition, adding micronutrient deficiency. And we have this triple burden in same country, in many countries. Right. So in fact, unhealthy diet continue to be main determinants of major NCDs. Unhealthy diet and malnutrition are the leading risk factors for the global burden of disease and death, claiming about 1/3 of all deaths in 2017. At the Leaders Forum yesterday, Minister Palau described NCD burden in his country. Uncontrolled diabetic patient may need to send to the Singapore or Philippines for amputation. Or patients suffering cardiovascular diseases may have difficulty to take operation timely manner. It is not about only Palau. NCDs come up huge costs and losses in all regions. So again, this slide shows the low and lower middle income countries. Food and nutrition related risk factors are in high ranks in the risk of death. This must be important things, and the most important things is that many of them are preventable with appropriate dietary and nutritional improvement. Food should not be cause of ill health. Therefore, we cannot discuss food systems without thinking nutrition, health, and human development in this generation and the future. Since challenges surrounding the food and nutrition are linked to the wide range of fields, including sustainable food systems, sustainable agricultural markets and trade system, and threats like climate change, natural disaster, and conflict. And we agree that addressing these challenges in food systems and nutrition requires diverse approach with collaboration among various stakeholders. The issue is how. So one of the good examples is the Eat Lancet report, published in 2019. As you may know that it was scientific review of what constitutes a healthy diet from the sustainable food system and which actions can support and speed up food systems transformation. The report described a reference diet that would provide health benefits based on the increased consumption of healthy food like vegetables and decreased consumption of unhealthy food like red meat and sugars. The report shows that how the adoption of the diet that have similar characteristics to the reference diet would allow to stay within planetary boundaries, even with the production increase needed to feed the world population and save approximately 10 million lives in the one lost to unhealthy diet. There were several discussions on this report, but I would like to highlight the importance of such a multi-sectorial data and research and holistic discussion. So let me touch on upon the global fora for food and nutrition and their outcomes. Okay, so in 2021, there are several important food and nutrition-related meetings, include Food System Summit and the Nutrition for Growth Summit, even though we are facing the COVID-19 pandemic. At that time, it was great to have a double opportunity to discuss food and nutrition at two summits. There come up with meaningful outcomes. But at the same time, it might be not only me who was questioning why these two meetings took place in 4 months. But when we talk about outcomes, one of the outcomes at the Food System Summit was Coalition for Action on Healthy Diet from Sustainable Food Systems for Children and All. The coalition has brought together member state, UN agencies, civil society organizations, academic institutions to aim to mobilize collaboration existing stakeholders to align action across food systems for collective impact at country level, facilitate peer-to-peer learning between countries, and manage special projects on integrated nutrition, health, and sustainability through food. So, food systems affect health of people, the planet, and animals in many ways. Yet, I thought that consideration of health impact have rarely been the central to discussion about food systems, and new thinking are required that place health at the heart of the transformation of food system policy and practice. Therefore, in WHO, we have developed the food system and health narrative that identified 5 interconnected and interrelated pathways through which food systems affect health. So one, unhealthy diet, food security, zoonotic pathogen and AMR, antimicrobial resistance, and the unsafe and adulterated food, environmental contaminants and degradation, occupational health, physical and mental health of people working in the food systems. This shows that there are many windows and opportunities to make food systems positively affect health and well-being. But I joined this forum, and I'm so happy that nutrition is going to the center of the discussion of the food system transformation. And now I talk about Nutrition for Growth Summit. Nutrition for Growth Summit started in 2013 in conjunction with London Olympic and Paralympic Games. At Tokyo Nutrition Growth Summit, N4G Summit in 2021, commitment from all stakeholders and action were focused on, rather than negotiation of the text of outcome documents. 399 commitments from 181 stakeholders, including 66 countries, 26 companies, and 51 civil societies organizations were submitted, with over $27 billion in nutrition-related funding pledged. To follow up implementation of these commitments, accountability framework was established in collaboration with Global Nutrition Report. French government is going to host the next N4G summit in March next year. I would like to work together with all of you to advocate nutrition and food systems transformation for safe, healthy, affordable, and sustainable food for all, and translate this principle to action. So let me move to the key issue for moving forward. Last year, I organized a public lecture on food and nutrition in my university. Experts from various fields, including government, politics, private sector, civil society, academia, and international organizations, brought several experiences and opinions during the series of the lecture. And finally, we came up 10 appeals for further commitment and action toward resolving food and nutrition challenges, which we would like to introduce as the preparation and discussion of French Nutrition for Growth Summit. So today, I would like to share some of them with you. First, comprehensive measures against multi-phase malnutrition. We strongly advocate for the formulation of concrete strategy and action plans to address complex issues related to undernutrition, overweight and obesity, and nutritional quality. Yesterday, several speakers mentioned the importance of cross-sectorial dialogues. ADB may provide opportunity for dialogue with agriculture, health, and environment ministers in Asian Pacific to accelerate joint action at country and regional level. On top of it, in the health system, we must integrate nutritional services as a component of primary health care and providing them within the universal health coverage. Since current UN Decade of Action on Nutrition, focusing on undernutrition, NCD measures should be clearly stated at the time of updating UN Decade. Second, to establish sustainable and healthy food environments, it is essential to adapt unique approaches tailored to the diverse health challenges of each country and its internal region. For example, the prevalence of population BMI, body mass index, greater or equal to 30 in US and European region is about 40%, while in Japan and several Asian countries, about 5%. In Japan, insufficient intake of meat and fat are issued to prevent frail or frailty of elderly rather than excess intake. The climate, social structure, and nutritional needs of residents vary greatly across the countries and regions, necessitating the development of food environment that take those factors into account. Specifically, the key lies in the utilizing local available, cost-effective, and environmentally friendly ingredient. It is desirable to respect unique food culture of each region that utilize these ingredients, while also contributing the creation of the employment opportunities and economic activities. And the third, resource reallocation. When we see the ranking of the cause of the death in low and lower middle income countries, NCD account for 41% of deaths in low income countries. However, looking at the resource allocation, it is biased toward the communicable diseases and child and maternal diseases. As you see, in health-related ODA allocated for NCD purposes account only 2% globally. It is important to re-evaluate current tendency to focus aid on hunger and infectious disease, and instead mobilize and enhance funding in low and middle income countries based on the concrete evidence of the relationship between diseases and malnutrition. Yesterday, Joe from IFAD presented a small ODA allocation to nutrition based on the data from agriculture side. We also talked about the inappropriate use of huge agriculture subsidies. Joint dialogues with cross-sector leaders and experts could be a window to find some solution. Is money for health cost or investment? In WHO or in government Japan, I faced this question many times. This Food Security Forum demonstrated the importance of defining and study investment comprehensively in and for our society. Investment to address food and nutrition issues should be made efficiently and strategically based on the specific evidence to avoid economic losses that may occur if the problem is left unresolved, and to promote further development of the entire society. So first, creative partnership with private sector. Regarding a role sharing between public and private sector to improve nutrition and food environment, WHO has developed a set of effective policy measures. These include the nutrition labeling policies, policies to protect children from the harmful impact of food marketing, fiscal policy including sin tax or school food nutrition policy, public food procurement and service policy, and reformulation policies including trans fat elimination, sodium reduction, and fortification of staple food. Innovative initiative by the private sector and collaboration through networks at the national and global level across industries are essential to overcome food and nutrition challenges. Not only the regulatory measures aim to reducing nutritional risks in processed food, but also the development of new, diverse, and positive models of collaboration with the private sector needs to be created and to be shared. So in our piece, there are several other points. When we talk about nutrition improvement, we need to consider personalized nutritional improvement for individuals like elderly, those with food allergies, and people with disabilities, tailored to their unique characteristics and needs. To make it happen, innovation and paradigm shift from supply side to demand side are necessary. Capacity building, including human resources like a nutritionist, is also important. Further commitment for individuals, countries, industry, and organizations are needed, along with responsible execution. We hope the Nutrition Summit in France will be a good opportunity for them. To conclude my presentation, I would like to emphasize the importance of the international cooperation of food and nutrition security and our effort toward building a peaceful and inclusive society. Addressing malnutrition among refugees and hunger issues due to the conflict or climate change requires global cooperation, and in the international cooperation for nutrition, establishing the continuum between emergency and hunger relief and regular time services is crucial. I believe that we can do more and better through cross-sector dialogue and joint action at country and region and global level to addressing the challenge of the food system transformation, climate change, and nutrition and health toward building peaceful and inclusive and sustainable society. So I thank you very much for your kind attention.
Dr. Emoto, thank you very much for your very clear and informative presentations. Now we would like to bring together different perspectives from different sectors, as she mentioned, that multi-sectoral sectoral approach is very important. So for that reason, we brought together panelists from nutrition research, food system, policy advocacy, and development finance. We have 6 panelists. Let me just call your name and title first, and after calling everyone going through, please come upstairs. First, we have His Excellency Yang San Koma, Dr. Koma. Thank you very much for coming. He is Secretary of State's Minister of Agriculture, Forestry and Fisheries of Cambodia. Now we have Manoj Kumar he is a Regional Director of Asia of Nutrition International. Manoj, thank you. And we have online, we have Ms. Abigail Perry, Director of Nutrition of World Food Program. Next, we have Irina Zodoro, Head of Partnership Finance Networks at the Scaling Up Nutrition Fund, Sun Network. And also Mr. Bob Babarajian, sorry, I should have pronounced. Babajanian, sorry, I should have practiced. Social Development Specialist, Human and Social Development Sector Group. Thank you very much from ADB. Finally, we have Ms. Kazuko Ugasawara, Senior Agriculture Natural Nutritional Specialist in the Sector Group. Okay, panelists, please come to the stage. Okay, thank you very much. So in the rest of the time, first I'd like to have comments and message from the panelists, from 6 of them. Then after that, I will open up for the QA. Please be ready to ask your question. I'd like to start with His Excellency Dr. Koma. You have a vast experience in NGO, academia, and also now you are Secretary of State of the government in Cambodia. And then among the panelists, you are the only person from the government side. So based on your background and current your activities at the ministry, could you explain your background and also activity, and also give us some comments? Yes, please.
Thank you. First of all, I would like to thank ADB for inviting me to come here and provide opportunity to discuss about the important topic on food security and nutrition. First, a little bit about my background. But when you look at my photo, it was taken 12 years ago, 2012. And actually, it was taken here in the Philippines, this photo. My last visit to the Philippines, it was in 2012. That time I got the Ramon Magsaysay Award. That's why I came to the Philippines, and this photo was exactly taken in the Philippines. Yes, as Takashi mentioned, so I have my background. I have studied agriculture. Got my PhD in agriculture in Germany, and since 1995, I work both in NGO and also at the Royal University of Agriculture. So I spent about 20 years with NGO, working mostly on the system of rice intensification, organic farming, and helped to assist to start the Cambodian National Farmer Network farm organization. And in December 2022, I joined the government and was appointed at that time as a minister attached to Prime Minister, but now currently I'm a Secretary of State of Ministry of Agriculture, Forestry and Fishery. And originally I was responsible for rice sector, but more and more now I take responsibility for deploying what we call a commune agriculture officer to work in all commune and village of Cambodia. So to work directly with the farmers. It's the first time that we start the National Agriculture Extension Program. And this is my mission, to make sure that we have good people to work with the farmers. Concerning nutrition and topic today, breaching food security and human development. So I would like to thank Dr. Yamamoto for your very good and very informative presentation. And it reflects also to the situation in Cambodia. If you look, actually Cambodia in terms of food security, in terms of rice, we have the problem that we have so much rice. We have population about 17 million, and now we are producing 12 million tons of paddy, so unmeal rice, and about 6 million tons exported, and 6 million is used in the country. Now we are not encourage the farmer to produce more rice, but to produce more efficient rice, so to reduce the cost, to improve the environment, to reduce the exposure to pesticide, to produce high quality rice, and to think more about the biodiversity. So when we talk about food security and nutrition in Cambodia, first talk about the rice, second about the fish, and third about the vegetable. So we have more rice, but now we have less fish, and we have less vegetable. So this is our direction, is to make sure that we can support our farmer to restore the biodiversity in the rice field, and also to increase more production and consumption of vegetable. Regarding the work that we also am trying to do, maybe just to add a little bit more, that because we are aware of this issue of nutrition, malnutrition, health disease, and also a lot of problems with human development. That's why the Cambodian government have developed a very good policy and strategy, and we have laid a very solid foundation, governance foundation, in which we have so-called at the national level, we have the National Working Group on Food Security and Nutrition. And recently, the government started the National Council on Nutrition. I also appointed to be the member of the council and chaired by the Prime Minister, actually. And at the provincial level, we have a provincial working group on food security and nutrition, chaired by the deputy governor. And now we go to the commune level to make sure that it's also integrated in the commune planning. And in every village, we have the so-called health support group, mostly two women per village, to promote the issue nutrition related to health and sanitation and so on. And now we add up into the whole system. As I said before, we're going to deploy 1,600 commune agriculture officers to work every commune one agriculture officer, so to promote the agricultural development, and also to link not only the market-oriented agriculture, but market-oriented and climate resilient and nutrition-sensitive agriculture. This is the big task ahead of us. And I'm happy to share more later concerning what we have been doing, and we are trying to do in Cambodia. Thank you.
Thank you very much. Now I'd like to invite Bob from Nutrition International. I would like to ask you to explain a little bit of Nutrition International, and also would like to ask, based on your regional experience, can you showcase good examples to improve nutrition in a multi-sectoral way? Yeah, thank you.
Sure. Thank you. My name is Manoj Kumar. I'm Asia Regional Director of Nutrition International. And Nutrition International is a global nonprofit committed for improving and enhancing nutrition across the world. We are, as an organization, we believe in evidence to action, and we work as an expert ally with the government across different parts in Africa and Asia to improve nutrition. So that's about Nutrition International. I would like, before I come on the question, Takashi, you asked, I wanted to talk a little bit about Uh, why are we talking about nutrition security and why is it different from food security? Because yesterday we had a discussion for prep for this meeting and we asked this question, and a colleague from ADB said that yes, we do need to talk about distinguishing between food security and nutrition security. What we believe that these two approaches are very complementary, though they are distinct. So food security addresses the issue of hunger, while nutrition security ensures that the right kind of nutrient in the body at the right time to ensure that people are healthier, they survive, and they thrive. When we look at in terms of food security, it addresses the issues of, and its success measures are access, availability, and affordability of food, while nutrition security success measures are making sure that number of lives are saved, number of health conditions, including stunting or anemia, averted, improved human capital in terms of number of school years for our targeted population, but also economic growth. As per World Bank assessment, there are 3.5 million trillion USD lost to global economy because of all forms of malnutrition. So thus, I wanted to set this stone to say why we're talking about nutrition security and why is it different from food security. Where I come from in Nutrition International, we believe that nutrition security is the goal and food security is one of the component of it. Coming back to the question about example of multi-sectoral nutrition intervention, despite the fact that we have already started talking about that malnutrition is a multi-dimensional challenge and it requires a multi-sectoral intervention, still we have not seen many examples of multi-sectoral nutrition response in the region. And I must admit that even at Nutrition International, we are learning. So we recently did a project in Bangladesh, in Cox's Bazar, where we had seen world's largest refugee crisis of Rohingyas. And so we implemented this multi-sectoral nutrition project in Cox's Bazar host community, it was supported by Canadian government. The basic objective of this project was to improve health and well-being of Cox's Bazar people by strengthening nutrition services delivered through health system, social protection, and other multi-sectoral services by different ministries. What we did, we very proactively and very intentionally, we got 8 priority ministries on board. And those are Health Ministry, Health and Family Planning Ministry, Agriculture Ministry, Fisheries, Livestock, Secondary Education, Women Affairs, Public Health, Engineering, and Food. And together we were able to help districts and upjilas in Cox's Bazar to develop gender-responsive multi-sectoral nutrition package for response. What we learned, the project is still going on. It will be finishing in a few months' time and we'll have a lot more learning. But some of the learnings I wanted to share here, what are the benefits of this multi-sectoral nutrition project? We were able to improve the coordination across all the 8 ministries by doing a joint planning. We did a joint budgeting across these 8 ministries at Jila, districts and Upjila level. We also did a coordinated implementation and joint monitoring of the project. So one of the big highlights of this multi-sectoral initiative, though we is yet to do the final baseline to see the results more based on the evidences, one of the things I wanted to highlight that it integrated nutrition in the 2 existing important social protection and safety net programs in Cox's Bazar. One is the Vulnerable Women Benefit Program, and second on food-friendly programs. And these are a good example of low-cost and scalable solutions that can make a difference in terms of addressing malnutrition. We also have another example from Pakistan, where we have been implementing a multi-sectoral project in 36 districts in Pakistan for stunting reduction. We're happy to talk more about this. I'll stop here, Takashi. Thank you.
Thank you, Bob. Now I'd like to invite Abigail on the screen. Abigail on the screen. Okay, could you put her on the screen? Abigail, Miss Abigail, can you hear me? Okay, very at the corner. Yeah, please bring her fully inside on the screen. Okay, so meanwhile, I'd like to ask Ms. Abigail. So you are from WFP, and I guess we don't need any introduction of what WFP. I understand that you have participated in many international conferences, organizations, including the last Food System Summit and Nutrition for Growth meeting in Tokyo. Based on your experience, what was the most important learning from these recent conferences? And you can add anything that you want to discuss. Abigail, please.
Thank you so much. It's a real delight to be able to join you. I'm a little bit sad that I'm not there physically in person. I suspect it would be a lot more stimulating discussion from my side if I was able to be in the room. So yes, my name is Abigail Perry. I'm the Director of Nutrition with the World Food Programme. Whilst I very much appreciate that the World Food Programme may need no background introduction, I do want to emphasise that the World Food Programme has been working across countries in Asia for many years now, working very closely in support of governments on their efforts to really look at integrating nutrition across different sectoral activities. This includes working, for example, with the government of Pakistan to look at enhancing the nutritional component of the Benazir Income Support Programme. It also includes working closely with a number of governments in the region to enhance the nutritional value of their school meals programme to ensure children really get access to the nutrients that they need at school to grow, to thrive, to do well into adulthood. It also includes integrating nutrition across investments that are really supporting smallholder farmers, looking at production of more nutritious foods, but also an enormous effort in hand with governments and indeed with partners like Nutrition International to support the scale-up of rice fortification, an effort that really does bring together multiple different sectors, including looking at private sector solutions to ensure that these really impactful interventions can actually reach those in greatest need. Now, coming back to your original question about some of the reflections from the big summits that have taken place, at the heart of a lot of what the World Food Programme has done in the Asia region and indeed beyond is to use data and analytics around the affordability of nutritious diets, around the impact of diets on climate and environmental consequences, and our Fill the Nutrient Gap approach to really help foster a collaborative discussion with governments to look at the practical solutions that could be taken to address the nutritional challenges that they're facing. We've worked with 13 governments across the Asia and Pacific region on using the Fill the Nutrient Gap approach. And I raise this because one of the biggest challenges that I see coming from initiatives such as the Food System Summit is to try and bring us back both to the question of who do we need to see change for, and how do we concretely move from a theoretical approach around nutrition integration into one where each part of the system can see the role that they can play. And this work that we've done around data and analytics and will continue to do with governments across the region, we've worked very closely with Cambodia, for example, is a really important opportunity to look at how we can properly harness the real power and might of different sectors, of the private sector as well. So as I said, we can move from kind of a more theoretical discussion to one where we can actually take practical steps. I agree with my colleague from Nutrition International that multi-stakeholder, multi-sector action can be incredibly difficult. But what we have found is that by using data, using evidence on affordability of nutritious diets, helps bring us all around a sense of a common understanding of the challenge at hand, and therefore helps us to really coalesce our investments and actions in much more concrete policy and program solutions that can really help deliver sustained change. So I think moving forward, I would love to see through mechanisms such as the follow-on Stop Taking Moments for the Food Systems Summit, and indeed through Nutrition for Growth, a much firmer use of data and evidence on who is most at risk, who is most affected by poor quality diets or a lack of access to nutritious diets, and why, so that we can help bring us all around some of these very impactful solutions, but solutions that still can be quite difficult to translate into national policies and programs. I'll stop there. I'm very happy to be part of the conversation today. Thank you.
Thank you very much, Abigail. Okay, thank you. Nice. Everyone is keeping in time, and I'm grateful for all the panelists. Now I'd like to, I'm not putting any pressure on next panelist. I'd like to invite Irina from SUN movement, scaling up nutrition. I think, SUN, could you explain a little bit of, especially emphasis, because you work with multi-sectoral, private sector, public sector, and all kinds of stakeholders. And also, could you mention a little bit of that responsibility of each stakeholders in different sectors? Thank you.
Thank you. I will not take it as a challenge to run over time. So I'm Irina. I'm from the Scaling Up Nutrition movement from the Secretariat. I will just go a little bit into SUN, but I'm very happy to speak after Mr. Kamo and the other panelists, because all of you, and we hope ADB will join us soon, are members of SUN. So it's actually a relatively easy setup for me. So SUN is a movement. It was created in 2010 in follow-up to the 2007-8 food crisis. As of today, it's 66 member countries which join SUN voluntarily. It's country-led, country-driven. So our focus is really on the countries themselves, what they identify as the priorities and needs. At the moment, we have 13 countries across Asia and Central Asia. These countries are supported by over 5,000 organizations by now, and they range from the donors and funders to international financial institutions, MDBs, the United Nations, business organizations, and civil society. Altogether, we are trying to tackle malnutrition in all its forms, highlighting thereby the systems approach that is needed and that has been repeatedly referenced across the last 2 days. In each of these 66 countries, we have a SUN focal point, often appointed at the highest level of government, President's Prime Minister's Office. Cambodia is a great, great example for this. And these focal points bring together multi-stakeholder platforms as a way of enabling the discussion between those who make the policies, those who bring the financing, those who implement. So now, I think one challenge that we face is that as of today, and already for a while, we do have some global blueprints. And most recently, we got, for example, the Food Systems Summit outcomes and the COP28 declarations, both on food and agriculture, but I also want to highlight the one on climate and health, which includes reference to healthy diets. But to capitalize on this momentum, we now really need to focus on accelerated action and financing at the national and subnational level. Really, to achieve lasting change for food systems, ag systems, health systems, nutrition should be mainstreamed into every policy, budgetary, and funding decision, really with the same way that we're looking at gender and climate at the moment. So the SUN partners are supporting the countries to join the dots between climate, food, ag, nutrition, health, the different sectors. And this support takes many forms because we have a lot of different partners. So it's advocacy, it's policy, it's technical assistance, it's capacity strengthening, it's monitoring, information, data, and obviously financing and resource mobilization. So I know the partners have already given quite a few examples, so I won't go much into these, but one of the key issues that we're facing is on the policy side to support the countries in linking the national nutrition strategies with the food systems pathways, and most recently then also the national determined contribution and national adaptation plans. And we have a session on Friday where one of our key partners, GAIN, will present a bit of the research that has been done under an initiative that's called the Initiative on Climate and Nutrition, ICAN, which highlighted that at this moment only 28% of national nutrition plans integrate concrete climate actions. And maybe worse, only 2% of NDCs and 16% of national adaptation plans outline tangible steps towards nutrition. Similarly, food-based dietary guidelines and public food procurement does not make the links very, very clear. And we spoke a few times about school meals. Abi is from WFP, so she knows much more about this than me, but these are important things that we need to tackle. Now, and I know my time is running out, one key issue is financing. And so I think over the 2 days that we hear so far, we repeatedly heard from the participants, and that aligns with what we're hearing from the Sun countries, that investment in nutrition is essential as a catalyst for food systems transformation and resilience, and thereby also for economic growth and sustainability. But we face major gaps. Now, we're working with a lot of partners. Again, it's from the institutional donors, but it's also MDBs. The World Bank was a founding partner of SUN. The African and Islamic Development Banks are in. Gates is in. Nutrition International as TA providers. Others are working actively with us to address this. And we focus hereby on the better use and increased domestic resource allocation, increased and more efficient official development assistance, but also unlocking new resources, including, I think we've heard it a few times, ideas on blended finance, innovative finance. And all of this trying to move from what is maybe more short-term interventions to putting it in the bigger picture of triggering transformation. So I will close here and just say, I think the assets of SUN are the 66 committed countries and the very active engagement that comes from them. Secondly, the partnerships that have been established and tried and tested for a long time. So SUN really offers the community a platform to come together and, on the one hand side, scale and replicate tried and tested and evidenced interventions, and also put our heads together and think about new ways of approaching these difficult issues that we're facing right now. Thank you.
Okay, yeah, thank you. Thank you very much. Now, Irina mentions about the financial challenges, and we have heard many times we need investment in nutrition. Now, I'd like to invite my colleague Bob about how ADB will mainstream nutrition into our multi-sectoral operation. Okay, Bob, please.
Thanks very much, Takashi, and it's a pleasure to be as part of this panel. So obviously, you can tackle malnutrition from different sectoral perspectives, and I come from social protection, so I want to highlight some of the experiences ADB has had in dealing with malnutrition from the social protection perspective. And obviously, what I'm going to do is just highlight some of the existing social protection instruments and showing how these instruments can actually lead to better nutrition outcomes and use the ADB experiences as examples. So obviously, cash transfers is the most commonplace social protection instrument, and we do know that cash transfers enable food security, and Manoj has very helpfully distinguished between food security and nutrition security. But to start with food security, we do know, so cash transfers, they enable access to food security, and there's a link to better nutrition, especially when individuals choose to diversify their diets. And we do know from evidence that in many cases they do so. So at the most basic level, I'm making a case for social protection and case for cash transfers as a very, very powerful instrument to support people with better food security and hence improve their nutrition outcomes. Therefore, the implication being there is a need to invest in better coverage, better targeting, and so on and so forth. Now, speaking of some other instruments, food stamps, food vouchers, and this is something that ADB has practiced. We have pioneered a very prominent program in Mongolia. It's called Food Stamps Program, and this program has been highly successful in enabling better food security, but also improving nutrition outcomes. And it did so by identifying 10 different types of food as part of the food stamp package and enabling people to choose one of those 10. These are high protein type foods. Now, this is still, this was done 10 years ago, and this was not the time when we're innovating, around nutrition. But this model is still powerful, and it has been used by ADB in collaboration with WFP in its pilot in the Philippines, and this pilot is going to support the government of the Philippines to implement a food voucher program that has got the same principle. It's got a package, a menu of different food items that people can choose from, and in this package it's much more innovative. So there is a combination of different types of food. So it's carbohydrates, proteins, fruit and vegetables. So there is a sort of balanced package, so to speak. And this is coupled with some skills sessions that enable behavioral change. Therefore, the assumption here is that better, as we've discussed, better food security doesn't necessarily lead to nutrition outcomes, and that preferences in behavior matters. So therefore, the assumption that by enabling people, providing access to knowledge through behavioral sessions can actually help them overcome some of the behavioral obstacles that and enable them to choose nutritious food. Now, another way to improve nutrition outcome is obviously to combine different sectors into one social protection intervention, and this is done through conditional cash transfers. Now, this is important. Why? Because we do know that even when you consume nutritious food, poor health matters. So you can only absorb nutritious food and have better health outcomes when you have access to better preventive health, you have access to healthcare, quality healthcare. Therefore, multi-sectoral interventions do matter, and we try to do so by linking up health, education, and nutrition through conditional cash transfers. The example is the program in Pakistan, and it was mentioned earlier. So this is the flagship Benazir income support project, where we're piloting an innovative health and nutrition CCT program. And here we also enable direct access to nutrition supplements for adolescent girls. So that's another instrument for enabling access. And then finally, one more aspect I would like to mention here is the gender dimension, and this is very, very, very important. And we do know that women are important for ensuring that their children are properly fed, and the decisions women make have very important implications for children's well-being. Therefore, women's empowerment is important. As part of sort of conditional cash transfers, what we do aim is the Pakistan program ensures that the cash transfers are given to women to start with, but also in other programs. So another project we're preparing in Laos, which would be again around nutrition-sensitive social protection. The idea would be to also include a separate component on graduation to enable women to earn income, diversify their income, and therefore hopefully be more in control of decision making, which also applies to decisions around food and nutrition. So that is very, very important. And finally, shocks. We're talking about shocks all the time, and therefore the ability of social protection programs to respond to shocks, to scale up, to enable people with better access to cash, instant cash, and food is key. And this is something, again, where we're introducing as part of our social protection programs across the bank, ADB being the climate bank. So climate dimension becomes an important institutionalized part of our programming. Thank you very much.
Thank you, Bob. So Bob discussed about the ADB projects from social protection side, nutrition-sensitive social protection. That I learned that term today. And so now I'd like to invite Kazuko, another my colleague. She's from the agriculture, food, natural resource sectors, and she has private sector background. Okay, please.
Thank you, Takashi-san. So after more than 20 years career in private sector, a food company, I joined ADB 3 years ago. And as a nutrition specialist, I worked in the agriculture, food, nature, and rural development sector group in ADB. And 2 years ago, we launched a cross-sectoral nutrition working group with health and social protection, gender and water specialists in, like Bob in the human and social development sector. And 3 years ago, also as a Tokyo Growth for Nutrition Summit in 2021, ADB committed to integrating nutrition into ADB's portfolio. So at first, we conducted a portfolio review of ADB projects and found that each sector already had a nutrition-sensitive project. Of course, we are aware that improving nutrition is vital to the societies and economy of ADB member countries. However, I think that more deliberate planning and more deliberate strategy can achieve better outcomes in improving nutritional status. Therefore, I believe that the nutrition working group needs to develop operational tools such as nutrition tracking tools or the nutrition markers to increase the number of nutrition-sensitive projects. This tool would facilitate and standardize the categorization of nutrition-sensitive projects in our portfolio. That would also provide clear expectation for each project and for ADB officials. With this tool, we will be able to track the extent to which our investments have contributed to nutrition security as well. As Dr. Naoko mentioned, the Nutrition for Growth Summit will be held again next year in March. And ADB will have accountability to report progress in a smart way, which will be included in the Global Nutrition Report. And my understanding is that accountability must be SMART. SMART means specific and measurable, achievable, relevant, and time-bound. For this reason, I believe the nutrition tracking tool is essential for us. And furthermore, ADB's major agenda is to combat climate change in the region, and the nutrition considerations are essential as well. So as a climate bank in the region, ADB will need to showcase the initiative for climate and food with nutrition in multi-sectoral way. I remember yesterday, Paul's Minister of Agriculture, Fisheries and Environment, Stefan Victor, made an excellent first statement. An integrated perspective and approach is crucial to a diet that is always healthy for humans and the planet. And all stakeholders are expected to work on behavior and mindset change. Considering ADB's role, as Naoko-sensei suggested, that we should take the opportunity to hold a dialogue session with ministers of agriculture, health, environment, and finance to accelerate the integrated actions. I appreciate the suggestion made by Naoko-sensei. And finally, I'm the only nutrition specialist in ADB currently. Also, I have excellent colleagues in bank-wide. I appreciate the collaboration and partnership with nutrition experts like you all, and expect continued engagement with us. Thank you.
We have close to 30 minutes for QA, so plenty of time. Now we can go slowly. And so, although this moderator note says take 1 or 2 questions, but I think I can take more than 1 or 2. So please be ready to raise questions. And who wants to go first? Anyone? Yes. Yeah. Please come to the microphone.
Thank you very much for the information, especially from the keynote speaker, on that we think beyond the concept of nutrition, but how the reason to much more motivation. But to be honest, my name is from the Alliance of Biodiversity and Sea Art under sg-afnr. We started the agriculture for nutrition and health in 2017, and at the beginning to brought the concept of food system for nutrition from the SLPE in 2017 up to the country is not an easy work, and even different level of planning, but also implementation. It took several years to much evidence, because if we just mention food system transformation, we write about research on what is not enough. They don't know where they are in food system. They don't know how they map their existing work together to think beyond the outcome in their mandate. Because, for example, in the countries we have the work in Vietnam, Cambodia, and also other countries like Bangladesh, we figure out Bangladesh have a lot of interlinked policy. And different countries can have different case study to go inside, but the problem is about how. Because the policy, the impact cannot be stopped at planning. They need to go to implementation. And in 2023, we work in the COP28 to mention about food system, nutrition, and climate. The problem is not about the government willingness. They're willing to adapt the concept, but then go into the subnational level for implementation. It's like puzzle of the work, because they only have some state budget for the thing under the existing legal system. It's not easy for them to integrate whatever we think from scientific that is good for the population. It's not about they don't want to do that, but they don't have those kind of capacity of the cross-sectoral to have the dialogue. Because we need to make assumption how the food system policy process dialogue can be happening for decision making, for the budget, the investment from the government. So why not livelihood? Why not income? Why nutrition? And why environment? They all need to understand on their specific food system context. And they need to map their national target program of the government into the priorities. And those things about the guidelines on what are really food system intervention, not there. And how they combine, because they need to implement NDC policy. They need to implement nutrition policy. They need to implement agriculture policy. But they have the same people committee. How one people committee can implement different policy in different expertise. And they are deep dive into sectoral work. They are not deep dive in system work. And we lack up the research to make sure we research on what. And we lack up the understanding from the donors to accept the research on how. It's also very important for food system transformation to identify leverage points to match to achieve different outcomes. So once again, I think I really liked the 2 days ago, because the first time many people say from the professor from Kobe University, he mentioned we all the time think on what, but we don't hear on how. But that's the community need that for implementation to bring the outcome in nutrition, not just the theory, not just the planning, but how to implement. Thank you. Yeah.
Thank you very much. Thank you. Thank you for the question. So this is a difficult question, how to bring the people on the table from different sectors and different levels. And so maybe Dr. Kumar, you have many years of experience from different sectors. Can I first ask you to respond? Maybe someone else also can support him.
Yeah, actually there are three things. One, they have a policy direction. And second, so we need to get people from different sectors to work together. As I said, national level and provincial level. But the real problem is, I agree that the actual implementation at the local level is very important. So there is a need to have a political leadership, this one. And in Cambodia, we have this kind of political leadership. Second, we need to have very good coordination, all the stakeholder actors, so from the government, from the development partner, so online. So we in the network also with SAN and so on, that we have the Council of Agriculture Rural Development that I also member. So also we try to bring together like Ministry of Health, Agriculture, Environment, Education, Rural Development to work together, and all the development partners. So what happened is that at the national level again, and at provincial level, everything is working. People come meet and discuss and so on. But that I mentioned before, so at the local level, they need a little support, capacity building report. They need to support in terms of resource and so on. That's why I come in, I join in this to complement to what is really, let's say, the gap. So we try to coordinate all actors, how to work together, including ADB. So we are discussing a lot also with the ADB, how we can support the real action at the community level, and to have also good monitoring and evaluation system to measure the impact, to get evidence, so that it can reinforce, the political leadership to provide more commitment, more resources. Even at the government level, we try also to make sure that the national budgets are allocated to support food security and nutrition and so on. There is a lot of work to do. And also, for example, between sectoral, even as we discussed 2 days ago, environment, agriculture, health, and so on, we need also learn to work together. And now we try to work together with the Ministry of Health, and also I try to work together with Ministry of Commerce on the market. And for example, about the World Food Program, they have a very good school feeding program. And before, difficult for them to work with the Ministry of Agriculture. Now they approached me, and so I opened the door. We would like to work with the World Food Program to link the school feeding program. It's also a very good example in Cambodia in terms of improving nutrition. It's also part of also investment in the local agriculture, because we support the local farmer to supply vegetable to the school. So improve the nutrition for the children, at the same time improve the income of the farmer. So in short, it's not easy. We can keep on talking and policy, dialogue, multi-sectoral. It's okay, but the actual implementation is still a big challenge for us. And we have to focus on that, building capacity at the local level, make sure that they receive good support, and make sure there is a very good monitoring and evaluation system to see the impact, to get more evidence. Thank you.
Thank you very much. And now I'd like to also ask Dr. Yamamoto to also respond.
Yes, because that question is quite crucial question. Because my career is based on not only the WHO, but in the government of Japan, and mainly based on the Minister of Health. As Honorable Secretary of State of the Cambodia said, that political leadership is quite important. But how to keep the political momentum? The global community's work is crucial to bring the issues again in the regional and political dialogue arena. Second issue is the voice of people and civil society. And not only the people in each country, we need more nutritious food for children or us, whatever. And also network with civil society organization together with others in a global level and regional level. And finally, I just added, we cannot change food system in one day, but let's find some critical one point which we could agree on within the different ministers or different stakeholders, and create, as some speaker has already said, that come up with a concrete indicators or marks, as you said, I think, to measure and find out some improvement. But again, not easy. When I was in the Ministry of Health and talk about, for example, AMR, antimicrobial resistance, with the Ministry of Agriculture. The huge discussion and how to do it, how to set a goal. But still, always we have some colleagues and friends and also partners to do it. So let's keep going on. Thank you.
Thank you very much. Irina, you'd like to join?
Just a couple of points. So on the one hand side, I mean, multi-stakeholder collaboration is difficult. That's why I think platforms like Sun, where you come together over and over again, build the trust and discuss, are key. Another thing that we've been doing over the past 2 years very extensively is peer-to-peer exchanges, really learn from others. And I think what Dr. Kumar just said is one of the examples, right? It's not perfect, it's never perfect, but there is some good examples. And then the last one that I wanted to throw in the round, also given where we sit here, is I think making the economic case for nutrition is really key. And this is why we're trying to build the relationships with partners that are not necessarily the nutrition partners, to understand better why someone who sits on a certain amount of money should prioritize investing in food security and nutrition and not in other areas, which are maybe equally important, but we have to showcase what the effects are, and then there will be trade-offs. I think we have to be cognizant on this. But what I think, and I'm not a nutritionist, so I challenge all my fellow panelists here or the audience to prove me wrong, but I think these economic numbers are not yet there. They're there in some parts, but not necessarily in a way that a Ministry of Finance would immediately be able to step up and understand what is requested. Maybe you want to talk to that. Thank you.
Okay, Manoj wants to go. Please keep it short. I have
Sure.
another question and probably other questions.
Sure. I just first reacting to a challenge from Arena. And so, Arena, you were asking about economic numbers. Nutrition International has a tool called cost of inaction tool. And this tool is primarily a solution for what you're talking about, economic numbers. So the tool calculates based on evidences if governments that don't act today, what's going to be the cost of that inaction. And if you want to know more, please come on Friday morning for a deep dive session at 9 to 10:30. Coming back to the question from the audience, yes, we have seen some real examples of where policies have been enacted, but then there's a gap in between the action and a policy. So we have a very recent example from Pakistan where we did a very strong advocacy to get 3 policies enacted, and these 3 policies are for mandatory food fortification. What we learned that it not just enough to get those policies enacted, but if you really want to see the impact, there's a lot more to be done. So number one, as you're talking about, Your Excellency, about political will, I would say political will to have more investment, commitment for more resources. Also, in terms of building the know-how, because we also realized that there was a policy, but then there was no capability, know-how within the government, and to take it forward. Number 3, there's a lack of data. If you don't have a right kind of mechanisms to collect right data, you don't know what is the right intervention within the policy to be taken forward. But also I would say it's important to look at the stakeholders, because we realize that government sometimes may not be able to implement a policy. They do need a multi-stakeholder, so private sector. For example, if you talk about food fortification, you definitely need a market-based domestic fortificants production to make it more scalable and feasible. That's all. Thanks.
Okay. Thank you very much. Let's go to so he was close to the mic, so give him a chance. And then this time answer just one person. Okay, let's go.
Yes. Good afternoon to all. I'm Emmanuel Velasco, and I have a different perspective because I represent the local government of Quezon City. I'm the co-chairperson of the Quezon City Food Security Task Force. I believe we're the only city in Metro Manila that has such a task force. This was created at the height of the pandemic as a food, health, and economic response to the pandemic. It is an interdepartmental and multi-sectoral task force. Just as a quick background to our panel, we are the largest city in the greater Metro Manila, comprising of 1/4, about 3 million to 4 million residents. We are also the gateway of food into greater Metro Manila that comes from the north. We have gone, our mayor is actually a climate advocate. She is a champion of the earth, identified by the United Nations awardee. We've created headway in terms of creating local policies to support climate, food, and nature, such as a healthy procurement policy, as well soon to be passed in a year's time, a calorie labeling policy. So because this is, we're also a member of the C40, as well as Milan Food Policy Pact. And it is shared there that in order to do real sustainable change, we cannot internally fund it. And that's why we are glad that we are here in this forum. So my question, since this is about financing, is that what is your perspective? And it was seen in the COVID-19 pandemic, that the local governments are more nimble to respond to food deterrence, okay? Whenever there's disaster, okay? We have closer access to our people and quickly respond. So the question is, what is the perspective of international funding in terms of how do local governments actually access it, and not only national government? Thank you very much.
Okay, so anyone who wants to take the challenge? Can I ask Bob? Because from the social protection perspective, right? So, not ADB discussed with the national government about loans, but who implements the activities, it goes down to local level. Do you have any, response to his question on the Quezon City? Yeah, okay, go ahead.
Yeah, thanks very much for the question. It's a very complex question because there is no a particular stance on this among international organizations. I think what we do know about this from literature is that obviously local agents are more responsive to local needs because they're closer to the population they serve, so they can respond on a timely basis, just like you mentioned the example of COVID and how local governments were actually able to respond. And same refers to other needs such as nutrition, food security, and so on and so forth. So, and we do know that decentralization and support for decentralization has been on the agenda of international organizations for many years. Obviously, the way we approach this has changed as we gathered more knowledge, more understanding of processes. I can give you an example of how, say, the ADB now promotes approaches to better resilience and better adaptation among communities facing climate risk. So these are actually decentralized approaches where we actually enable communities to come up with innovative solutions, to mobilize their resources, to tell the funders about the ways, the more effective ways of responding, addressing people's needs. So that's in relation to climate change. Obviously, nutrition is something that I haven't had experience in terms of those kind of decentralized approaches. But my hunch, my guess is that similarly, community-based approaches could be very powerful.
Okay, no, but there's
just a quick response.
Yeah.
Well, anyway, I represent the mayor, and if there are any international or programs, we actually have a partnership with sg-afnr for resilient cities, which we're doing and piloting in Quezon City. So you're all welcome to learn with us, study with us, go through it together in order for us to have a better world.
Thank you very much. So let's go to the next question.
Yes, I'm JP from the Association for the Rights of Children in Southeast Asia. We are a civil society organization. So when we talk about nutrition or malnutrition, the idea that comes to mind based on the intervention starting from yesterday is promoting more nutritious and more healthy foods. But of course, this is just one side of the equation in terms of consumption. The other side is, for example, some effects such as obesity are not because they don't eat, at all, or but it's because the food that they choose to eat or are available to them are not good for their body. So I haven't heard any points, for example, regarding how should we deal with foods that are actually not good for the health, especially for children, for example, who are particularly, I think yesterday it was mentioned about high sugar foods, high fat, and high salt foods, which are really have been proven to be not good for bodies. But unfortunately, these are the available and very accessible foods, especially to low-income families. That's why I believe that it also contributes to the problem of nutrition. But what do you think should be done regarding these producers, for example, which are usually, they have the investments are on that side of the production. So it's difficult to promote, for example, consumption of healthy foods. It makes it even more challenging because the available foods are these kinds of foods. Thank you.
Anyone? Yeah, so, Holly. Miss Abigail, I haven't forgotten you, so if you have any response from online, please come in. Would you like to take that? Could you hear that question, or maybe next one?
I could indeed, and you're not bad to bring me in. I put my hand up to respond.
Oh, sorry. sorry. Okay, please come in.
I'm so very, very glad that somebody's raised this really important issue. I mean, the work that we do at community level, really looking at how to support access to nutritious diets, you know, we are constantly challenged by the fact that we have that, you know, very available, very affordable foods that are very enjoyable in many cases for women, young children, families to eat that aren't good for their health. Again, we've really been trying to push this question of using data and analysis to demonstrate the challenge that these kind of foods play in terms of displacing how families can use limited resources towards healthier options. But it also really does highlight the issue over the fact that those options that are less healthy are, frankly, so much more affordable, so much more available. Now, I am at the point in my career working in nutrition where I feel that we can do as much as we can at local levels, working with communities to support better food choices. But ultimately, this comes down to that difficult question of the national level policy environment and the degree to which healthier options can be made more affordable, more accessible, and that the unhealthier options can be made less affordable and less accessible. We know we've seen a lot of progress around sugar-sweetened beverage taxation, with governments also in some context using the revenue to support community health and nutrition projects. But unfortunately, it is only going to be that kind of action that can help us to kind of really shift the dial. Because really, when it comes to it, families are really, in many of the countries that we're working in, still really challenged to afford a nutritious diet. And I'm not surprised they're making the choices they are. There are some really interesting studies that have been done in contexts like Nepal, where you're talking to poor households who say, I just need to feed my child, and they will eat a sugary biscuit. It's harder. I mean, anybody who's had children or has children knows how hard it can be to get them to eat a range of different foods. And unfortunately, these very palatable foods, they go down easily. So if you're going to spend your money, of course, that feels like the best option, and it fills your child's belly, but it doesn't help them grow properly, and it puts them at risk of overweight and obesity and diet-related NCDs. So unfortunately, in this area, I do think it is going to be about some quite tough choices in terms of the national policy environment. And we've seen countries who are brave enough to take that step forward. And just building on earlier comments about the economic argument around this, I'd also encourage everybody to shift this around a little bit, to rather than talking about it in terms of the costs to economies, talk about it as an investment opportunity. Because investing, including in the policy space, investing in the health and nutrition of our children, of how they'll grow and develop, it is an investment. It's an investment in a healthier, more productive, workforce, who can grow economies, be resilient. And I think there's something incredibly positive to talk about it in investment terms. It sounds a bit ruthless, because that we really should see it as that. That's the only way that we're going to save all the costs on healthcare, ensure that people can be out there, be healthy, thrive, and help countries grow. So yeah, I think we need some quite tough discussions about the policy environment on this particular issue. Thanks.
Thank you, Abigail. Thank you very much. I'd like to ask the operator to open the chat box on the screen so that everyone can see the questions. Meanwhile, Kazuko has mentioned, just very quickly this one.
Okay. So in terms of policy and who choice, the private sector is an important stakeholder, I think, because food company is a supplier of the healthy diet. So the private company has an influential power to the consumer, and they can change the behavior of food habit. Yes.
Okay, thank you very much. Yes, just one. So he has been raising questions. And anyone who has questions, please come after this session. Please come to the panelists and we can have discussions. Okay, the last one. Yeah.
I don't have question, but I just want to contribute and participate. And my name is Ham Chantu. I'm senior project officer in ADB Cambodia. I am not nutrition specialist, but I coordinated the work of nutrition and specialists. So I mean, the nutrition issues is not the same from one region to another, and from country to another, and from one location to another. The coastal area has different nutrition problems to the mountainous area. And also, they are evolving from time to time. For example, like 20 years ago, the biggest problem in Cambodia is stunting and wastings. And now it starts reducing, and with a new phenomena of obesity. And every several years, the government of Cambodia, they conducted like a national survey, socio-economic surveys, and they find somewhere which is stunting highs, and somewhere is wasting high, and somewhere is obesity. And they found out that the obesity is happening in the richest family, where the mother are so busy, where the stunting is in the poorest area. So that means solution to the issue is not the same. You cannot put more money to the obesity family, or you can put, a certain thing to the different issue. So that's why when I undertake a project, which I have about 500,000 beneficiaries, and I know the issues of nutrition in that particular areas. So that's why, following Excellency Kumar's suggestion that at the commune level, there is a committee on mother and child care. So I mobilized that committee. I hired nutrition specialists to go and train that committee, work with that committee, and mobilize all the mother, parent takers. And we use the national standard to prepare some certain food that meet that certain issues, so that the child, when they grow up, they will replace their parents with a healthy, bodies and mind and also. So I think what I wanted to say is that the money is not always the solution for nutrition. So it's awareness, education, trainings from time to time, and behavior change toward the food. This is important. Thank you very much.
Okay, thank you very much. So we come to the end of this sessions, and I'm supposed to summarize the discussion, but I don't want to take time out of you. I just want to mention that food security, but also the nutrition security, investment in the nutrition in different sectors, multi-sectoral approach. We have heard nutrition-sensitive social protection, nutrition-sensitive agriculture policy, nutrition-sensitive to this and that. These are the words for the multi-sectoral approach that we take. So with this, so the purpose of this session was to develop networking across different groups. So I encourage people to come to the panelists to ask questions that you didn't, you wanted to ask but could not. So thank you everyone for coming to this session. I hope you will also enjoy the rest of this forum. Thank you.